Intravenous therapy, blood product transfusion. Blood products are transfused to restore and/or maintain fluid volume, improve the oxygen carrying capacity of the blood. We expect each unit of packed red blood cells to raise the hemoglobin 1 gram per deciliter. It's also used to replace deficient blood components, assist with coagulation, or prevent cardiogenic shock and help maintain hemostasis. Criteria for transfusion. We used to base our transfusion on the level of the hemoglobin or hematocrit, and that's just not done anymore. It's not given automatically with those low blood levels. We base that more on the symptoms, including shortness of air, tachycardia, low blood pressure, chest pain, lightheadedness, and extreme fatigue. Blood products come in several forms. It can be administered as whole blood, but to decrease potential transfusion reactions or complications, such as fluid overload, whole blood is often administered in specific products. So we have packed red blood cells, or PRBCs, fresh frozen plasma, or FFPs. This is the fluid portion of the blood, and it contains some coagulation factors. Cryoprecipitate, which is mostly the clotting proteins, platelets, and granulocytes. Most blood transfusions are going to come from donors, and we term this allogenic, but clients can self-donate, and we consider this to be an autologous transfusion. There are 4 types of blood, and that consists of the types A, B, AB, and O. Then we have the Rh factor, which is either positive or negative, and we determine that by the presence or absence of what we call the D antigen. Due to type O blood having no A or B or D antigens, type O negative blood can be given to anyone in an emergency, regardless of their blood type and Rh factor. So we call them the universal donor. Due to type AB blood having no A or B antibody, these people can receive any blood. We call them the universal recipient. Now, if they do have a negative D antigen, then it has to be a negative type blood. In most states, LPNs are not going to be allowed to initiate a blood transfusion, but they are allowed to monitor the client while receiving the transfusion. Policies for administering blood products will vary, so it's important to be familiar with and follow your institution's policies. But prior to the infusion of any blood product, we need to draw a blood sample. We send that for type and cross-match. A type and cross-match will be done to help prevent or reduce the risk of an antigen or antibody reaction. The typing will determine the ABO and the Rh, while the cross-matching checks for the antibodies in the recipient's blood that might react to antigens in the donor's blood. The nurse obtains informed consent per facility protocol. Make sure you have client IV access. If it's a peripheral site, a 20 or 22 gauge is recommended, but a 24 gauge can be used if needed, and a larger gauge is used if a rapid infusion is required, and all central lines can be used. Obtain your blood administration set. It does have a built-in filter. It can be a single set with 1 spike, or it can be a Y set with 2 spikes. And this is where we put the blood on 1 spike and we put normal saline on the 2nd spike. The administration set will be changed at least every 4 hours or after each unit of PRBCs if it's run over 4 hours. Normal saline is the only solution to be used in the administration of blood products. Pre-medicate the client per orders. At times, some healthcare providers will pre-medicate with acetaminophen or diphenhydramine, etc. Obtain 1 unit of blood from the blood bank. You can only contain or you can only obtain multiple units in an emergency situation where you are having to uh, just basically pour the blood into the veins. The unit of blood that you obtain has to be initiated within 30 minutes of receiving the unit to the nursing unit. Then you check the blood component against the orders, and then check it again at the client's bedside with a second licensed professional. You have to match the following to what is on the blood ticket that's attached to the unit per the facility protocol. So we look at the recipient's ID number, the recipient's name, the blood component ID number, the type of blood component, the AB and RH type, the expiration date. We also check to make sure that the component looks normal. We don't see any clots, discoloration, gas formation, cloudiness, etc. And make sure that the container has no leaks. Obtain pre-transfusion vital signs and then per facility protocol. For example, every 5 minutes for 15 minutes, then 30 minutes, then following the transfusion. Transfuse per recommendations or orders. With PRBCs, we start slow for 15 minutes and then transfuse at a rate to be completed within 4 hours. All other blood components can be administered at the ordered rate right from the beginning. Your fresh frozen plasma needs to be infused over 1 to 2 hours. Your cryoprecipitate will expire after 6 hours, so it needs to be infused before that. An IV line administration set has to have that normal saline going. Make sure that your blood products has been checked by 2 licensed professionals. Initiate the blood product within 30 minutes of receiving it at the bedside. If you cannot do that, then you have to return that unit to the blood bank. Vital signs are required prior to the administration and then again per facility policy. Use tubing with a built-in filter. The nurse has to stay with the client for at least 5 to 10 minutes after initiation to observe for any potential adverse reactions. If you're doing rapid transfusions, we may need to use a blood warmer. And pressure bags might be used if we're having to run that blood quickly. Some physicians, again, are going to require pre-medication prior to transfusions. So there are some don'ts. We don't add medications to any blood component. We don't transfuse the unit if any discrepancies are noted during the checking of the component. And we don't piggyback the blood into any solution other than normal saline. Again, vital signs per your facility's recommendations, but it is definitely required pre-transfusion and at least 5 to 15 minutes after initiation. Always keep an eye on that insertion site and then monitor for side effects. Fever, chills, rigors, headache, nausea, facial flushing, rash, back pain, or dizziness are the main side effects you may see. If you note side effects, then stop the infusion immediately. Disconnect the administration set and connect a new set with normal saline to the IV catheter. Obtain vital signs, a urine sample. Call lab to draw a blood sample. Notify the healthcare provider of the client's condition. treat their symptoms, return the blood bag with the ticket and the administration set, including the normal saline, to the blood bank. And be aware that mild reactions may not require discontinuation of the unit. In other words, one of the side effects is a fever. So if the client's temperature was 98.8 prior to administration, and now we have a temperature of 99.5, we consider that a mild elevation, and that may not require discontinuation of the unit. It may just require slowing of the transfusion rate or administration of medications to treat symptoms. But notify the healthcare provider and allow them to make that determination of discontinuing the unit in those mild reactions. With all clients, but especially the older clients, monitor for fluid overload. There's several types of reactions, but there's three main reactions that we discuss in this course. That includes your hemolytic, which is caused by incompatible blood, and it can result in renal failure and shock, and it can be life-threatening. Febrile, which is caused by the client's antibodies reacting against antigens to the donor's white blood cells or platelets. It causes flu-like symptoms, chest pain, and hypotension. And allergic reactions, which are caused by an allergen present in the transfused blood. It will cause hives, itching, fever, chills, facial swelling, wheezing, and/or a sore throat.